Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Welcome to About the Face, the Facial Plastic Surgery and Aesthetic Medicine Journal podcast, where we explore the latest trends, data, and developments in facial plastic and reconstructive surgery. I'm your host, Allie Burgess, and today we're diving into a topic that has become increasingly relevant: how patients find and trust medical information online. Specifically, we're looking at cosmetic surgery on social media. And not any cosmetic surgery. Today, we're zooming in on male rhinoplasty and how platforms like YouTube and TikTok are shaping the narrative. If you've ever scrolled past a 15-second nose job transformation, you've probably wondered, is this real? Is this helpful? Or is it just another filtered snapshot in the sea of misinformation? Joining me today is Dr. Roxana Moayer, facial plastic and reconstructive surgery faculty at Keck School of Medicine at USC, and senior author of a recent paper published in Facial Plastic, Surgery, and Aesthetic Medicine that tackled this exact topic. Dr. Moayer, thank you so much for joining us.
Thanks, Allie. I look forward to talking about our work.
So let's start with the basics. Of all the aesthetic procedures you could have studied, why focus on male rhinoplasty in particular? Was there something about this population that you felt was especially relevant?
Yes, great question. Rhinoplasty has consistently ranked among the most common cosmetic procedures for men, and we're seeing a steady increase in interest among males in aesthetic surgery overall. And what stood out to us was that anecdotally, it seemed like these patients would go online before talking to a provider. They'd watch these videos, look up testimonials, sometimes for quite a while, even before booking the consultation. And that made us want to ask, what kind of information are they actually seeing online and how trustworthy is it?
Definitely, that's so true. And these days, that first impression often isn't your website or the hospital website, it's TikTok or a YouTube video. And so it's important to evaluate what's actually out there. Your team used the DISCERN scale, and for listeners who aren't familiar, can you walk us through what that measures?
Absolutely. So, DISCERN is a validated tool originally created to assess the quality of written health information. It breaks things down into three main categories. First, reliability. Are the sources cited? Is the content current? Is it free of bias? And then secondly, quality of information. So does it explain treatment options, risks, benefits, alternatives, things that we talk about in consent? And third, an overall score summarizing how useful it would be for someone making a medical decision. And each of those items is scored 1 to 5. And even though it was designed for print, it's been adapted for evaluating video content in recent studies, including ours.
So your team reviewed over 400 videos, and 264 of them were from YouTube, and 165 were from TikTok. That's a lot of videos. Were there any findings that really surprised you through all of those content reviews?
Actually, yes. We expected some variability, but the gap between platforms was more dramatic than we thought. YouTube consistently scored higher across the board in quality, reliability, and overall discern scores. And TikTok, in contrast, scored significantly lower, especially in reliability. And there wasn't a single topic where TikTok outperformed YouTube.
Interesting. That's really striking. And when you think about how fast and trendy TikTok content has to be, it kind of makes sense, but it also raises a lot of concerns. The platform's whole appeal seems to be brevity and virality, not the actual portrayal of complex topics like surgery. Can you give an example of some of the types of misinformation or misleading content that you came across?
Definitely. The one common issue is oversimplifying or glamorizing the procedure. For example, some TikToks would suggest that rhinoplasty is something very quick and easy, in and out with no mention of recovery, risks, or individual variability. And others showed dramatic before and after results with no context, no mention of healing time, no disclosure if the photos were filtered or staged. And that creates a really unrealistic picture of what surgery entails.
Right. I've definitely seen those rhinoplasty videos that are just 10 seconds long, no captions, and no real content or information. So it's easy to imagine someone seeing that and thinking, that's exactly what I want without really understanding the risks and complexity behind it. So, in terms of the people behind the content, did you find that there was any type of account that influenced how reliable the information was?
There was. So we found that videos from academic institutions and healthcare groups scored somewhat higher in both quality and reliability compared to those from individual accounts or physicians. And to be clear, that's not to say that individual physician content quality was low, but there was some tendency for it to be a little bit more market driven. The best performing videos were those with an educational tone, usually or often backed by institutions that prioritize clarity and balance.
Definitely, that makes sense. And for surgeons who are trying to educate on social media, sometimes it feels like you have to have the correct hashtags and play the algorithm game just to get noticed. Have you noticed any tension between creating engaging content and sticking to evidence-based messaging?
That's a great point. Yes, that is something very challenging, I think, for physicians. Platforms tend to reward engagement and attention, not necessarily accuracy. But I'd argue that physicians and institutions have an opportunity to meet patients where they are. You don't necessarily have to do the dances and some of the gimmicks that you see unless that's aligned with your personality and speaks to you.
Right.
But just speaking clearly and showing your expertise and being transparent about what surgery truly can and cannot do, that alone stands out online.
Definitely. And I think we're starting to see some of the platforms step in a little bit, especially with tackling misinformation. So YouTube has started to label health videos from hospitals and academic groups to help people spot credible content. Do you think TikTok should do something similar? Have you noticed any interventions on TikTok like that?
Yeah, I think that's an interesting point. I think there's some opportunity to mitigate misinformation by doing that, but I also don't think that those systems are infallible. And so I think even more importantly, the onus is on the physician to be aware that misinformation is out there and bring that up when we're talking to patients directly before we sign them up for surgery.
Definitely. And, when patients are seeking surgery and they have all these preconceived notions, maybe previously it had been more on websites and not in day to day social media, but it's just another kind of piece of the puzzle that we need to consider when counseling. Before we wrap up, anything else you'd like to see in future research or next steps beyond this study?
Definitely. I'd like to see more work on patient perceptions, how they interpret what they see online. We focused on content analysis, but what really matters is whether that content affects patients' decision making and also exploring how physicians can really use these platforms accurately to educate patients without compromising professionalism. And then also just looking at how this impacts our in person conversations with patients.
Absolutely. This is such important work and also ever changing in today's society and how information is spread so virally. So that's a wrap for today's episode of About the Face. If you're a surgeon, educator, or content creator, this is your reminder. Your voice online matters, whether you're making one video or a whole series. Honest, clear content could be someone's first step towards understanding their surgical options. Dr. Moyer, thank you so much for joining us and sharing your insights.
Thanks so much for having me.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.